I'm Dr. Antonio Webb. In this video, I'm going to talk about some of the top things that they don't teach us in medical school. So this year makes 10 years since I've graduated from Georgetown Medical School. I learned a lot on this journey, and there are some things that I wish I would have known earlier. Let's dive into the realities of being a doctor that medical school does not teach you. One thing's for sure, they don't teach us everything in medical school or residency. It's impossible. That's why it's called practicing medicine. But you do need to have a strong foundation to build on. The business of medicine, marketing, dealing with insurance companies are a few examples of what makes practicing medicine challenging. But here's the hard truth. As doctors, we need to take care of ourselves before we can effectively take care of others. Physician burnout and suicide are real issues, not necessarily topics they touch on during medical school. An estimated 300 physicians die by suicide in the US each year. Unaddressed mental health conditions in the long run are more likely to have a negative impact on the physician's professional reputation and practice than reaching out for help early on. The next thing is that intrusion of insurance companies and politics in medicine complicates everything. Insurance companies dictate how we practice, how much we get paid, and therefore overshadowing patient care. I didn't learn in medical school that insurance and politics should not be involved in medicine. Speaking of insurance, it's disheartening to see that while our expenses rise with inflation, physician salaries do not keep pace. Each year, physicians get paid less and less while the CEOs, the medical executives, and other hospital administrators get paid more. We find ourselves seeing more patients and doing more surgeries just to make ends meet, a trend that I fear will continue. I don't think medicine will be the same in the next 5 to 10 years. And let me be clear, if you're considering medicine for the money, think again. There's a huge element of delayed gratification in this field. It's not about the financial gain, it's about the commitment to help, even though you can't help everyone. That brings me to one of the hardest parts of my job, which is telling a patient that I can't help them. It's a very sobering moment that every physician dreads. You come out of medical school with this hunger and altruistic mentality, wanting to help everyone, but soon after, while practicing, you realize this is impossible to do. There are some patients that come in with conditions that are far advanced than what you've seen or learned about, in addition to having medical comorbidities that precludes a safe and effective way to treat them. This was an unfortunate reality check for me when I got out into practice, and not something that I learned about during medical school. But despite these challenges, being a physician is incredibly rewarding. It's a journey of lifelong learning and profound human connection. Thank you for joining me today as I reflect on these last 10 years. Remember, the journey of medicine is as much about growing as a person as it is about healing others.